Thank you very much. I couldn't agree more on your comments on the lack of proper evaluation in these old people. So now we have time for questions for our three speakers left here, and there's one down there.
Thank you, all speakers. My question is about the Alzheimer's disease early diagnosis. I'm from India, and in the clinical setting and also in the society, what we generally see, the Alzheimer's is genetic. We do have sporadic cases, but mostly what we see are the genetic cases. So if we consider the genetics, and also we'll see the cell death, causes may be different. Alzheimer's is the one cause of cell death. And if we understand the genetic basis, and I just want to ask you that the cell death that happens in the second trimester of embryonic development, and the cell death in some people happens at the age of 50th of age years. Can we have this reason to find out any underlying pathological model, something like that, to understand the early symptoms in Alzheimer's?
Alexander, it's for you.
Well, I will try. Well, as far as all of us know, there are genetic cases or genetic forms of Alzheimer's disease. They are rare, and as I outlined in my presentation, they are caused by mutations in 3 different genes or in 3 different places, but they are rare. The occurrence of several cases of Alzheimer's disease in one family is just caused by the frequency of the disease in old age. So if there are several members affected at the age of 70 or 80, that usually is not a genetic familiar case. The pathology that happens in Alzheimer's disease is relatively well described. So I think to work on an effective treatment of Alzheimer's disease, it does not, the problem is not lack of understanding of disease, but how to interfere with the event of pathological changes that I also have tried to demonstrate. And I must confess I didn't get the rest of the question.
But I think you have answered more or less what you were asked to. So we have more questions down here.
Hi there, I enjoyed all your presentations. I'm not really from a clinical background. I'm a social researcher, a carer and a psychiatric nurse. And obviously I've done a lot of research, dementia research from the social side of things. But I've also had an interest on, the NUN study in America, the quite famous one that shows that not everybody who gets Alzheimer's actually develops the disease. And I've asked different people and I've had different answers. And I think like some people actually have a residual or it's quite complex. And I know you talked about macrophages. And I think from a lay perspective, I just wondered, is it individual difference in the inflammatory response?
So,
again,
would you try again?
Again, well, there is an inflammatory response in the brain when the plaques accumulate, when the amyloid gets deposited, and this inflammatory response makes the conditions, the living conditions for the nerve cells worse than they would be without. So there are inflammatory responses, but they are not, for my understanding, they are not at the core of disease, which is also reflected in the fact that anti-inflammatory drugs don't have an effect on the progression of Alzheimer's disease, and they produce a lot of side effects. but are not effective as a treatment. And that goes for any inflammatory drugs that have been tested so far.
Okay, thank you. More questions? No, that seems not to be the case. Oh, actually, there's one more.
Also, you talked about removing beta amyloids by antibodies. So, in the beginning of your presentation, so how will it work on the mass scale? Because we have many cases in Alzheimer's. So, how long does it take for a single person, and what is the cost of it, and how it will work on the masses?
Well, this is a very important question. So we are about to discover, or many of us are involved in discovering an effective treatment of Alzheimer's disease in terms of slowing down the progression, for example, using antibodies. It is not clear to date how expensive this kind of treatment will be. It will be probably, again, my personal view, it will be significantly more expensive than the cholinesterases or cholinesterase inhibitors that we use today. Who will have access to these drugs? That's a very important societal question. There will be a huge debate going on. Should it be available to all people who are at risk of developing Alzheimer's disease? Will it be available only for those who can afford it out of their own pocket? This is a debate that hasn't started yet. But we already see it foreshadows. But at this time, there is no clear answer to your question.
So thank you very much. I would like to thank the organizers, the presenters, and the audience for this very interesting last session. So please stay in the room. We are coming to the closing ceremony, and we will leave the floor and then invite the people for the ceremony up here. So thank you very much.